Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. An innovative, first-of-its-kind, non-invasive blood test can potentially improve outcomes for millions of people with advanced liver disease. An estimated 80 to 90 million people in the United States have diagnosed or undiagnosed non-alcoholic fatty liver disease, or NAFLD, and up to 20 million of these individuals could have non-alcoholic steatohepatitis, or NASH. Now, NASH is a disease characterized by inflammation of the liver, which can ultimately lead to cirrhosis. Here to help us understand more about this disease and how a new test will help assess the risk of disease progression in NASH patients is Dr. Zobair Younossi, Chairman, Department of Medicine and Professor of Medicine, Inova Fairfax Medical Campus, and Dr. Chuck Cooper, Chief Medical Officer, Siemens Healthcare Diagnostics at Siemens Healthineers. Dr. Younossi, if you could start us off by telling us more about this condition known as NASH.
So NASH, or non-alcoholic steatohepatitis, is a liver condition where fat accumulates in the liver, and it's a part of the broader fatty liver or non-alcoholic fatty liver sort of disease that affects probably about 25% of U.S. population. Some patients with NASH can progress in terms of scarring of the liver and leading to cirrhosis, which is extensive scarring of the liver, and complications like liver cancer and liver mortality. This disease is very common, and in fact, it parallels that of obesity and type 2 diabetes. So we're expecting this to increase and become a leading indication for liver transplantation and a major cause of liver cancer and mortality in the United States as well as the rest of the world.
Well, could you briefly describe some of the current challenges that these patients face?
So I think if we take a global perspective about this disease, the three main challenges are, number one, there's low awareness about this disease at the level of patients, providers, and physicians, and policymakers. The second challenge, of course, is that there's no drug approved for treatment of this disease. So we do lifestyle modification, weight loss, etc. The third is that it's not always easy to predict which patient actually will develop bad these diseases. So in the past, about complication. In the past, we've used a liver biopsy, which is invasive and expensive, and not a lot of people wanted to do it. Now there is a blood test that's available that can actually give us an indication or a prognostic sort of window about which patients can develop bad liver disease. And that test is called Enhanced Liver Fibrosis test or ALP test, made by Siemens.
I did mention that there's a new test for this condition. Dr. Cooper, could you tell us more about this new test?
Yes, so we here at Siemens Healthineers have introduced a new test called the Enhanced Liver Fibrosis test, or the ELF test. And this is the first approved non-invasive blood test that really helps healthcare practitioners and patients understand which patients are at increased or highest risk for progressing to severe liver outcomes like cirrhosis or liver failure or other potentially life-threatening liver outcomes. And so what this test allows us to do is identify which patients could benefit most from early preemptive care that could be potentially life-saving. And so this is an important new tool in the fight against this deadly disease.
Just how important is this new test? Is this going to be a game changer in your opinion?
It's a game changer for a few different reasons. One reason is that this is a simple, easy test. It's a blood test like any other blood test. So as such, it can reach patients wherever they are, and it can provide critical prognostic information to help us understand a patient's risk. And actually, just last week, the American Association of Clinical Endocrinology released new clinical practice guidelines for the diagnosis and management of non-alcoholic fatty liver disease. And these guidelines recommend the use of ELF to help understand a patient's risk for progression to severe disease in those patients who have NASH and clinically significant fibrosis.
Dr. Younossi, as we talk about these helpful advances, what would you say are the main takeaways?
Well, first, the burden of disease is high and it's increasing, parallel to that of diabetes and obesity. We are, in the future, will develop some new drugs for this, but it's going to be a few years away. The best thing to do is to now risk stratify these patients. And you can do this now with an easy blood test, the ELF test. And more information about this test is available at Siemens-Healthineer-US/ELF, which is really available and will give you a lot more information.
Well, I appreciate both of you joining us here on Health Professional Radio, both Dr. Younossi and Dr. Cooper. Thank you so much.
Thank you very much.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.